Afternoon, everyone. My name is Sakthi Karunanithi. I'm a public health consultant with background, currently working as the Director of Public Health. Um, my journey started in India, actually. I was born in India. I was there till 2005. And then I moved over to this country in 2005 and worked my way up from being a senior house officer to a consultant, and now currently working as Director of Public Health in Lancashire. Um, the thing that really inspired me to choose public health was when I was a junior. There would be sat in clinics. Basically, people will come in with various issues, but particularly the ones that affected me was tuberculosis and respiratory disease, where I would be signing people off work, knowing that they could have been prevented if the living conditions were better and if we could have picked the disease up earlier. So that sort of inspired me to choose prevention as my path. And I worked in various settings in India and in the UK, both in the hospital wards as a frontline practitioner, but now I'm working as a director of public health, where, which is um, which is a key protect our health and well-being, which is what we're mainly involved in terms of the COVID-19. I along the way picked up working in various sectors, the NHS, local government, and I was also fortunate to be part of the Yale Global Health Leadership Initiative, particularly the Systems Leadership Program. Um, the main one that we're currently working on is COVID, and what my role in that is to help others understand how it is affecting our local communities, how it's spreading, but also working across agencies from enforcement agencies like the police and the councils, the NHS, but also the testing and tracing, and communicating with various parts of our society so that people are fully informed of how to take steps ourselves, but also what other things need to be in place from testing and tracing and enforcement. It's a huge logistical exercise at the moment. What really has given me that inspiration and motivation is the ability to make a big difference to a large number of our fellow citizens. But this has not been an easy journey to pick because, first of all, public health is not very widely known as a career option. And the second one really is you don't tend to see the difference that you're making immediately. So it's a longer term game. However, COVID-19 has completely changed it, and the way that public health operates in this country is quite right at the centre of everyone's attention. Um, I've personally, coming from a South Asian, South Indian background, and certainly moving to the UK has not been an easy transition. I still remember living in box rooms in East London, going and doing my exams with GMC and living on £1 burgers for at least a few months. But what I've held within myself, I just wanted to share some of the things that really has helped me. Um, and that is, don't take no as an answer. If you genuinely believe something that is it inspires you, and if you want to achieve that, I've always held the view that I'm not going to take no as an answer. I work hard, but it is very easy to be caught in prejudices and various perspectives. So, especially if you're from this background, um, be curious. And that's sort of held strong for me in terms of understanding. There's always difference. On one hand, you've got the herd immunity thinkers, and we let the virus rip and just protect the elderly and vulnerable, which is not feasible for forever. On the other hand, it's shutting everything down, which isn't also feasible. So um, being curious has held well for me in terms of constantly understanding what's going on around, and trying to use different approaches, and not just what you come from, as in your background and your medical background or whichever background it is. So that expanded my perspectives, and knowing oneself well, it's easily said than done. And what I mean by that is my personal prejudices, my personal strengths, but also weaknesses, and be honest with myself, and that helped me to improve myself. And fundamentally, apart from all of that, forming good working relationships and amicable relationships with everybody around me, I think has been very useful, and that is again easily said than done, because quite often, especially as you move up the career, or even in other positions, there's always various different perspectives, and it's easy to take positions and uh, prove that one is right and the other one is wrong. Um, but it isn't quite that. And getting good relationships, often with friends, but also with colleagues, who can put the mirror up and show what's going on, and that again helped me understand. So those really helped me well in my stead, and has helped me. One of my inspiration leaders is Gandhi, and I just wanted to finish up with his quotes. And the first one is more personal, especially when you are bringing a very different perspective to any group, any work. At first, often I think that perspective gets ignored, and then you'll have to find your way. But eventually, if you don't give up and if you form good relationships, I think that quote from Gandhi has proven true for me. And the final one I want to say is, um, people choose careers for different reasons, but fundamentally, I believe that health is the real wealth, and it isn't just yours, but also the team's. So if you know yourselves well, and I've attempted to do that, it often pays off at a good starting point, and especially mental health is very, very important at these very stressful times. So those would be my parting comments. People who are interested in public health, it's a very fulfilling career option. You can choose public health from whichever discipline in health, or even non-health disciplines that you're from. And I've got a few minute video, a 3 minute video, that if it is possible to play at the end, just to help everyone understand the breadth of the public health career. And I wish you all well. Thank you.
Even before a child is born, a quest to ensure its long and healthy life begins. All over the world, public health programs work to improve the health and well-being of communities by identifying the risks that affect different people, in different places, at different stages of life, and finding the best ways to minimize them. It's about giving everyone the best chance to lead long, healthy, fulfilling lives from the very beginning to the very end. A child dies every 3 seconds from infectious disease, but public health interventions can prevent this by promoting things like breastfeeding, immunization, and antibiotics. Where children die because they have no access to safe water or basic sanitation, public health programs can make water safe and conditions sanitary. Where research shows us who has the highest risk of developing certain conditions, public health applies it to the real world. It turns evidence into the advice and practical help we need to lead active, healthy lives away from danger. It helps us make the right choices and form the right habits that impact on our health now and long into the future. Poor health doesn't just cost lives, it costs money too. By preventing, detecting and treating disease as effectively as we can, public health can help to halt the spiralling costs of treatment, saving lives and saving money. Public health is about understanding the huge impact that our financial, social and environmental circumstances have on our health, and reducing the differences between us to make us all healthier. It's about making health achievable in mind and body, at home and at work, by supporting individuals, families and communities in the environments they live and work in. It's about working to ensure that no one is left out or left behind as we strive for better. Public health, preventing disease, prolonging life, promoting health, for everyone at every stage of life.